is Alexia, and today I'll be doing my neurovascular assessment. First, I'm going to go to my patient's room, provide patient privacy by closing curtain or door, and then I'll perform hand hygiene, introduce myself to the patient, and then I'll identify my patient with 2 patient identifiers. Hi, my name is Alexia. I'm going to be your nurse tonight. Can you tell me your first and last name and date of birth, please?
Secretly Cortez, date of birth is January 10, 2005.
Okay, great. And then I'll explain the assessment to my patient. So today I'm going to do a neurovascular assessment on you. It's just to evaluate your nerve system and making sure it's intact and functioning appropriately, okay? Do you have any questions for me?
No.
Okay, so we're going to start off now. First is going to be assessing sensory response to superficial pain and touch. So for this one, I'm going to have 3 different objects. And then you're going to put your arms like that. There you go. So with this one, I'm going to touch you in these areas right here. And with your eyes closed, you're going to point to where I touched you and if it was soft, dull, or sharp, okay? Start off now. Close your eyes.
Soft. Sharp. Dull.
Okay, great. So now the next one will be perception of position with movement of toes and fingers. So for this one, we're gonna put your digits either up or down, and you're gonna tell me with your eyes closed if your digits are going up or down. Close your eyes. Okay, just arm open. Okay.
Up. Down. Up. Down.
Okay, great. Thank you. Now we're gonna next will be identifying object by touch. So I'm gonna give you an object in your arm, in your hand, sorry, and then you're gonna close your eyes and tell me what it is. Close your eyes, okay.
A coin.
Okay, great, thank you. Now moving on to assessing two-point discrimination. So for this one, I'm gonna use a bobby pin, and then I'm gonna touch you right here, and then you're gonna say 2 until you feel 1. Okay, close your eyes. Great.
2. 2. 1.
Okay, great. And for this one, we'll document the 2 points closest to each other. Now we're going to identify number drawn on palm. So you're going to close your eyes for me, and then I'm going to draw a number in your palm. You're going to tell me what number it is, okay?
3.
Great, thank you. Now that we've done that, the next one will be ability to identify body area when touch. So for this one, you're gonna close your eyes, and then I'm gonna touch any a certain area of your body, and you're gonna tell me, you're gonna point to where I touch you, okay? Close your eyes for me. Okay. Okay, great, thank you. So now that we've done that, now we're going to assess your deep tendon reflexes. So I'm going to start off with your bicep tendon. So for this one, we're going to look for our bicep tendon right here. And then we're going to put our thumb on it, and with the sharp side of our reflex hammer, we're going to tap. Okay, great. Now we're going to move on to our patellar tendon. So for this one, we're going to look at the kneecap. That little dent right there with the long side of our reflex hammer, we're going to tap right here. Okay, great. Now that we've done that, we're going to move on to our plantar reflex. So for this one, it's going to be under the leg right here. So we're going to use this sharp side, or this side of our reflex hammer. We're going to go laterally up and across. And then if the toes curl, it is a normal response, but if the toes curl backwards, it is abnormal. So ready? Okay, great. Now after that, we're going to assess our ankle clonus. So for this one, we're going to dorsiflex our feet like that, and then we're gonna let it relax. Okay, so just how it's relaxing, that is normal response, negative clonus. But if the feet were to jerk down slowly like that and shake, that will be abnormal response, positive clonus. So now that we did that, now we're going to assess cerebral function and proprioception. So for this one, with your heel, you're going to start on this side on your knee, go down your shin, down to your feet, and do the same thing to the other side, okay? Okay, great, thank you. So now that we've done that, we're gonna assess coordination and fine motor skills. So for this one, you're gonna go like this. Okay, close your eyes. Faster. Okay, great. Now I'm gonna have you stand up and you're gonna run in place, okay? Okay, great. You can take a seat now. Now that that is done, we're gonna do our Romber's test. So a Romber's test is to assess your balance, see if there's any loss of balance. So I'm gonna have you stand up. For safety, I'm gonna put a hand in the front, hand in the back, and we're gonna count for 60 seconds or a minute, starting now. Okay, great. And for this one, we counted with our watch for 60 seconds and our minute. Okay, you can take a seat. Now, lastly, it will be assessing your gait. So for this one, I'm gonna have you walk back and forth. And while the patient does that, we are going to assess the rhythm, posture, sequence of stride, and arm movement. So we're gonna walk, stand up, we're gonna walk forward. Okay, come back. Okay, we're assessing. Everything is normal. Now that is the done of our assessment. You can take a seat. Are you comfortable?
Yeah.
Okay, make sure our patient is comfortable before we leave. Call light is within reach, and side table as well, and make sure the bed is at lowest position. Now we're going to perform hand hygiene and document findings. Thank you.